next one. Are you suffering from insomnia or sleep apnea, or you just wonder why you can't get enough sleep? Well, maybe there's something to it. That's why we've got Dr. Farney here. And Dr. Farney, you're with?
I'm with the Intermountain Sleep Disorder Center at LDS Hospital.
And that's where we are right now. And I think people probably come to you with the two biggest questions. Why don't I get enough sleep, and how much sleep do I need?
Yes, they come in with the complaint of tiredness, difficulty sleeping, and the first question that we have is this a psychiatric, psychological stress problem, or is it a more serious medical problem like obstructive sleep apnea?
Now, do sleep disorders usually go hand in hand with the body and the psychological aspects?
Absolutely. You know, if you're worried about something, you're not going to sleep very well. If you can't breathe when you're asleep, you're not going to sleep very well.
All right, so let's define insomnia. What is insomnia?
Insomnia is the perception that you can't fall asleep when you want to, that you wake up too soon, that you're waking up frequently during the night. It's just a sense of crummy sleep, and you don't feel good the next day.
When someone thinks they may be suffering from insomnia, at what point do they give you guys a call?
Well, if it's been going on for many years, everyone has insomnia. You know, that's not abnormal. Being short of breath is not abnormal. But when you're short of breath, when you do minimal normal activity, you want to see somebody. If you can't sleep night after night after night, and it's affecting you, it's affecting your work, your socialization, your pleasure in life, then that's a problem.
All right, so we've tackled insomnia just a little bit. Now we want to go over to sleep apnea. What is sleep apnea?
Sleep apnea is the problem of keeping your airway open when you're not fully awake. If you go to sleep, if you're unconscious for any reason, there's a tendency of your throat to fall together. The tongue falls to the back of the throat and closes off the airway.
And that's bad. And so here we've got some devices to help you with that. One of those would be kind of a dental help.
Well, there's a variety of options. One is a back pillow that if you put on your back and keep you off your back, then your jaw doesn't fall back and you're less likely to block off your airway. Or you might consider a dental appliance that's fabricated specifically for you that holds the jaw forward, just like an anesthesiologist would do when you get an anesthesia. To hold the jaw forward keeps the airway open. Or you can wear a small mask through which we have some air flowing, creating some air pressure, and the air pressure pushes the tongue forward and keeps the airway open. We also have surgical options too. So there's a variety of options, mainly to keep the upper airway open.
Perfect. And if you have some questions, we have experts standing by all day today up until 6 p.m. All you have to do is give us a call at 1-877-908-0680 with any sleep question. We can help you with that. Okay, so I'm a hand talker. Now you're doing it.
Now I'm doing it.
She's like this.
Yeah, I can see your daughter doing that in the background. All right, so still to come on Fresh Living, we are getting